Revision on different clinical scenarios. This is Professor Maha Shaheen. Our lecture today about different scenarios of clinical cases. The first case is a 45-year-old lady who developed foreign body sensation. Questions may be something like, what are causes of foreign body sensation? This lady also complains of photophobia. Questions may be asked like, what is photophobia? What is the differential diagnosis of photophobia? The lady has tearing in her left eye. Visual acuity is normal. Examination revealed proptosis and lid retraction on the left eye. What is proptosis? What are investigations of proptosis? How would you diagnose a case of proptosis? What is the most common cause of unilateral proptosis? What is the most common cause of bilateral proptosis? What is lid retraction? What is the normal position of the upper eyelid? What is the normal position of the lower eyelid? There was resistance to retropulsion of the globe on palpation through the lids on both sides. Explain the resistance to retropulsion. Slit lamp examination with fluorescein staining of the cornea showed superficial punctate corneal erosion inferiorly in the left eye. What is fluorescein staining of the cornea? How do you do this test? Why the superficial punctate erosion was seen inferiorly? Past history revealed treatment for Graves' disease 3 years ago. What is your most probable diagnosis? What are the different modalities for treatment of such condition? Frequent use of artificial tears relieved her symptoms for a few months. Why the artificial tears relieved her symptoms? She then had a recurrence. She also reported diplopia on reading. What is diplopia? What are types of diplopia? How do you differentiate between types of diplopia? Give examples for each type of diplopia. Re-examination disclosed slight reduction in the visual acuity of the left eye and increased proptosis. What are the causes of vision reduction in such case? She had limitation of elevation and depression of the left eye. What are the causes of limitation of the muscles in this condition? This slide shows the proptosis of the patient. What signs are seen in this slide? When you are faced with question related to the photo in the slide, please, your answer should be directed only to the signs in this particular photo. Do not include all signs in the case of proptosis, but just mention the sign presented in the slide. This slide shows another sign. What test is seen in this photo? What are the findings of this test? How would you treat these findings? What clinical test is seen in this slide? What is the importance of this clinical test in a case of proptosis? What investigation is seen in this slide? What are the findings in this disease? What causes this finding? Now we shift to another case, a case of uveitis. A 56-year-old woman presents with a red, painful left eye. She has this complaint for 3 days. Take care. When you have duration, then use this piece of information to classify the disease, either if it is acute or chronic, because causes of acute red eye is different from causes of chronic red eye. She has been very sensitive to light since the pain began. So, what is this complaint? What is the differential diagnosis of this complaint? She denies any trauma. She had past history of difficult breathing. What is the importance of this information in a case of uveitis? What other diseases you should ask about in a case of uveitis? Her examination is significant for visual acuity of 6/6 in the right eye and 6/36 in the left eye. Her left eye has ciliary injection. What is ciliary injection? She has cells and flare in the anterior chamber and large maton fat kibes on the corneal endothelium in the left eye. What is your most probable diagnosis? Numerous cells are seen in the vitreous, and the view of the retina is hazy. What investigation do you recommend to investigate the retina when the view of the fundus is hazy? What sign is seen in this slide? This slide shows kibes, keratic precipitates. The slit lamp projects a beam of light on the cornea. and the cells are seen on the back of the cornea. These are the keratic precipitates or KPs. Most of the time in the exam, there will be an arrow pointing to a certain sign in the eye. Just mention that sign. This slide shows other signs seen in a case of uveitis. This is an angry eye. We can see intense ciliary injection. The injection is seen around the limbus and extends to the periphery. The limbus is the junction between the cornea and the sclera. Another sign is the irregular myotic pupil. Pus is seen in the anterior chamber. The anterior chamber is the space between the cornea and the iris. Pus in the anterior chamber is called hypopyon. What is the treatment of uveitis? What are the complications of uveitis? A 40-year-old woman had diabetes for 20 years. On her annual ophthalmic visit, hard exudates were noted together with retinal edema adjacent to the left macula. Her vision was 6/6 in the right eye and 6/9 in the left eye. Laser treatment was recommended. Which part of the eye is examined in these photos? These are the direct and indirect ophthalmoscope used to examine the fundus. The ophthalmologist is using the indirect ophthalmoscope together with the lens to examine the patient in the left photo. The right photo shows the direct ophthalmoscope. What is the difference between the two of them? What is other third method for examining the fundus? This slide shows a normal fundus. The optic disc is a relatively slight pink circle in the left part of the fundus. It has a well-defined border. The smaller circle inside the optic disc is called the cup. The ratio between the optic cup and the optic disc is called the cup-disc ratio. Retinal blood vessels come out of the optic disc. The optic disc has a well-defined border. You can easily run a pencil around the optic disc, clearly identifying its border. The retinal artery and vein usually run beside each other. Each small branch of the retinal artery is accompanied by a small branch of the retinal vein. Each one of them divides only into 2 branches. This is the normal retinal vasculature. The central part of the fundus is the macula. It's the dark red area with glistening appearance and absence of blood vessels. This is the normal fundus. This slide shows different signs in case of diabetic retinopathy. The yellowish lesion seen in the center of the fundus is called hard exit. Why they are yellow? Because they contain lipids. They are lipoprotein. What are these 2 white lesions in the inferior part of the fundus? These are cotton wool spot, or the other name is soft exit. Why they are white? Because they represent infarction. They are micro-infarction of the nerve fiber layer of the retina. Multiple red dots are seen in the fundus. These red dots are either microaneurysm or dots of hemorrhage. Fluorescein angiography can differentiate between microaneurysm and dots of hemorrhage. The larger reddish lesions are blots of hemorrhage. No new vessels are seen in this slide. This slide shows hard exit in the left part of the fundus, in the temporal part of the fundus, with adjacent retinal edema. Retinal edema is known by thickening of the retina. The optic disc has ill-defined border. You cannot identify the border of the optic disc with tortuous retinal blood vessels. This slide shows abnormal blood vessels seen in cases of proliferative diabetic retinopathy. These abnormal blood vessels are called new vessels. They are present either at the disc, called new vessels at the disc, NVG, or in different parts of the retina, called new vessels elsewhere, or NVE. They are immature blood vessels, so they can easily leak blood out of them. They are a network of branching small blood vessels. They are completely different from the normal retinal vasculature. What investigations are done in a case of diabetic retinopathy? What investigation is seen in this slide? This slide shows fundus fluorescein angiography. This black and white appearance is fundus fluorescein angiography. What other investigation is done in case of diabetic retinopathy? This slide shows OCT. This color-coded investigation shows the layers of the retina and the thickness of the retina. What are risk factors for diabetic retinopathy? What is the treatment of diabetic retinopathy? In case of diabetic macular edema, we have to differentiate between if it is the edema involving the center or not involving the center. If the edema is involving the center, then the treatment is intravitreal injection of anti-VEGF. Anti-VEGF means anti-vascular endothelial growth factor. Second line of treatment after failure of anti-VEGF in case of center involving diabetic macular edema is intravitreal injection of triamcinolone acetonide. If the diabetic macular edema is clinically significant but not involving the center, then laser treatment is recommended. Pan-retinal photocoagulation is indicated in cases of proliferative diabetic retinopathy. Pan-retinal photocoagulation aims to destroy the peripheral part of the retina so that reserve the small amount of blood reaching the retina to the more important central retina. In all cases, whether the patient will receive intravitreal injection, whether the patient will receive laser treatment, or just follow up, you have to control the systemic factors. The most important one of them is control of diabetes by hemoglobin A1C done every 3 months. You have to control the hypertension. You have to control the hyperlipidemia. Another case. This is a 64-year-old woman who was watching TV when she noticed that her vision had become dim in the right eye. So this complaint occurred suddenly. This is sudden diminution of vision. She felt well otherwise and had no pain. She came to the emergency room. So this is a case of sudden, painless diminution of vision. What is your differential diagnosis? Your differential diagnosis may include vitreous hemorrhage, may include central retinal artery occlusion, may include retinal detachment. It should not include uveitis, as uveitis is painful. It should not include cataract, as cataract is chronic. So pay attention to the small details of the case scenario while putting your differential diagnosis list. Vision was limited to light perception in the right eye, but left eye was 6/9. There was a right afferent pupillary defect. What is the meaning of afferent pupillary defect? What happens to the right pupil when you apply the light to the right eye? What happens to the right pupil when you apply the light to the left eye? Explain the answer. The fundus of the right eye shows narrowed vessels. Most of the retina are pale and the macula shows a cherry red spot. What is the cherry red spot? What is the differential diagnosis of a cherry red spot? This slide shows central retinal artery occlusion. What is the cause of cherry red spot in a case of central retinal artery occlusion? In this slide, the whitened area of the retina is limited to the upper retina. So this is a case of branch artery occlusion. What is the treatment of a case of artery occlusion? What are risk factors for developing artery occlusion? What is the best timing for treatment of an artery occlusion? This slide shows other findings for a case of sudden, painless diminution of vision. This slide shows flame-shaped hemorrhage and exudate in the fourth quadrant of the fundus. This is a case of retinal vein occlusion. What are the types of vein occlusion? What are the risk factors for development of vein occlusion? What is the treatment of a case of vein occlusion? What are the complications of a case of vein occlusion? What are the causes of long-term loss of vision in a case of vein occlusion? A 35-year-old lady noted loss of vision in both eyes, lasting seconds after bending over to pick up a box. She developed a headache 2 weeks earlier. On examination, visual acuity was 6/6 in both eyes. Her visual field shows constriction in both eyes. What clinical tests you can do in the clinic to test for the visual field? What investigation do you recommend for testing the visual field? This slide shows fundus examination of the patient. It shows bilateral disc edema with dilated tortuous retinal veins. As you can see, the optic disc has ill-defined borders. You cannot anymore use the pen to draw the borders of the optic disc. This is a case of papilledema. It is bilateral and it has a good visual acuity. What are the causes of papilledema? What is the investigation in cases of papilledema? What are visual field findings in case of papilledema? This slide shows other findings in case of papilledema. Still, the optic disc has ill-defined borders. In addition, there are hemorrhage and exudates. Trauma is seen in the ER room of the ophthalmology. For example, we have a 5-year-old boy splashed his face with household detergent accidentally. He complains of severe photophobia and foreign body sensation in both eyes. Again, we may ask about the meaning of photophobia, the differential diagnosis of photophobia, the differential diagnosis of foreign body sensation. He has marked conjunctival ecchymosis. What is the meaning of conjunctival ecchymosis? His cornea are edematous. The anterior chamber details structures are visualized. What is the importance of this sign? His IOP, his intraocular pressure, is within normal limits. This is a case of chemical trauma to the eye. How would you treat this child? What are the complications of chemical trauma? If you have a busy clinic, what is your priority to treat a case of chemical trauma? Another case is a 17-year-old boy who was hit in a fight. He complained of seeing the objects double, so he covers either eye with his hand. This relieves his complaint. What is the differential diagnosis of his particular complaint? His friends have noticed that one eye seems smaller than the other eye. What is the sign? What is the differential diagnosis of this sign? What is your most probable diagnosis? What investigation do you order for such case? This is a case of blew-out fracture. As you see, this is his CT that shows fracture in the inferior wall of the orbit. The patient cannot elevate his traumatized eye because the inferior ocular muscles are entrapped in the fractured floor. What is the treatment of such case? This 15-year-old boy was brought to the ER after sudden diminution of vision in the right eye. He was hit by a ball few hours earlier. What do you see in this photo? What is your diagnosis? How would you treat such case? Is there a special position for this patient? What are the complications of this condition? What are the causes of long-term diminution of vision of such patient? What are the indications of surgery for this patient? Finally, and this is not uncommon in our country, especially in the East. A 35-year-old patient was brought to the emergency department after playing with his cousins in the feast using bead pistol. There is almost no sight in the left eye with hypotony. What is the differential diagnosis of hypotony following eye trauma? What do you see in the eye of this patient? We can see uveal tissue out of the eye. This is a case of ruptured globe. In addition, hemorrhage is seen in the anterior chamber. This patient has also hyphema. In order to save eyes, please discourage your relatives, your neighbors, from using such toys in the feast time. What is the treatment of this condition? Thank you.